Didascalinophobia, or the specific phobia of going to school, is pretty rare among school-aged children. However, quite a few kids are affected by the general fear of going to school. These both tend to have an underlying cause, which could be a fear of riding in the school bus, being in a crowded classroom, being bullied, left out, getting bad grades, or they could be due to separation anxiety. How do parents help children overcome these afflictions? In cognitive behavioral therapy, the key is to find out exactly what the child's fear is and why he or she is afraid. In other words, identify and change the present disturbing thoughts or behaviors. In the following examples, we'll accomplish this through exposure therapy in virtual reality. If the fear exists specifically in riding the school bus, the child would experience riding to school in the car with a parent, then walking onto the school bus, first sitting alone with only a few other students on the bus, then sitting next to someone else, and finally actually driving to the school in a full bus. The child would also practice making friends so as to make the reality of riding in the bus less stressful. In the case of a fear of crowded classrooms, the student would first experience an empty classroom, and then it would gradually become more crowded. If a fear of being bullied was present, he or she would experience what it would be like to be bullied and then be taught how to combat the negative feelings that would arise. Specifically, he or she would learn how to respond to the bully and then go tell a teacher or a parent. If the child were to be afraid of being left out, he or she would learn how to make friends and ask to play, as well as experience rejection, so as to see there's really nothing to be afraid of. There would be a similar experience for a fear of getting bad grades. The student would experience how the teacher would confront him or her, how the parents would react, and then would learn how to process the emotions and ask for help. Finally, if the fear was specific to separation anxiety, the child would go through a typical school day sequence, including saying goodbye to the parent and then seeing the parent at the end of the day. Most of these virtual reality exposures simply involve allowing the child to experience the feared situation in a comfortable setting with a trusted adult present. This is beneficial because it would allow for the realization that the fears usually don't come true. On the other hand, if the fears do come true, the children are able to stop the experience whenever needed and are taught how to process their negative emotions as well as how to respond appropriately.